Hi, so the next part of the presentation that we're going to talk about is reservoir. So necrotizing fasciitis is found in humans, but also it's found in cattle, so that's where it grows and lives. One interesting fact is that it can actually be passed through the milk of cattle, so it can be passed from cows to humans through their milk. Obviously it's going to be unpasteurized, so I thought that was kind of interesting. The next thing we're going to talk about are the signs of necrotizing fasciitis.
So one of the first signs of necrotizing fasciitis is going to be swelling and redness. So you can see in this photo that this patient has a really swollen leg, and it's really red around that wound, and that just kind of shows the swelling and redness that would occur in the first stages of necrotizing fasciitis. So along with swelling and redness, one of the other signs is that people with cellulitis and erysipelas, they're more likely to have necrotizing fasciitis just because of that infection in their skin. So that if they do have that disease first, it's more likely that they can get necrotizing fasciitis, more likely than somebody that doesn't have those. The next is a raised white cell count. And that's just because a person with an infection will have more white cells in their body. They'll have raised glucose levels and also vomiting. So next I'm going to talk about symptoms. But before I do that, I'm just going to talk about the difference between signs and symptoms. So signs of a disease would be what you see. So in necrotizing fasciitis, we saw the redness, we see the vomiting, we see the raised white cell count, but the symptoms are subjective, so it's what the patient's telling you they're feeling. So one of the symptoms of necrotizing fasciitis will be tenderness, and you can see in that picture that that looks very tender. Also, that pain at the site is going to be disproportional to the wound. So it could be a small cut, but it'll be a lot of pain for that patient. Next is going to be intense thirst, and that's just due to the dehydration that the patient is experiencing. Next is nausea, so they'll feel sick and they'll have fatigue. So now I'm going to talk about the finger test. The finger test is just a test that physicians use to decide whether it is necrotizing fasciitis. So what they do is they cut a 2-centimeter incision at the site, and then they'll notice like if there's a lack of bleeding, and also there's going to be like a dishwater pus coming from that wound. Then they're going to stick their finger in that open sore, and they're going to push on the tissue. And if the tissue kind of gives way or falls apart, it's called blunt finger dissection. That's a big sign that it's necrotizing fasciitis. So I just thought that was kind of something that was interesting to show you guys. That's how physicians test for it.